Hello everyone, welcome to this channel. In my last video, I talked about our small intestine. If you have not seen the video, then click on the button and watch the video now. Today I will talk about our large intestine, which is our last part of our GI system. As you can see in this photo, this large intestine, it lengths in our male body almost 165 centimeter, and in female body, it almost 155 centimeter. And the volume of the large intestine is almost 1.5 liter. Okay, so in this photo, this large intestine consists of 6 segments. First part, cecum associated with appendix, which I will talk about later. Second part, ascending colon. Third, transverse colon. Fourth, descending colon. Fifth, sigmoid colon. Then rectum, and it ends in anal canal. Okay. And now cecum. As I said already, it's situated in our right iliac fossa. Okay. The length of our cecum is 6 cm and 7.5 cm broad. Okay, it continues as ascending colon. Alright. Now, the relationship of cecum in our abdomen is in posteriorly, you will find right iliacus muscle, right psoas muscle. Okay, then femoral nerve, lateral cutaneous nerve of thigh. Okay, and also you will find in male testicular artery, testicular vein, and in female right ovarian artery, right ovarian vein. Okay. Now, anteriorly you will find coils of intestine, mainly the ileum part. Okay. Ascending colon. As I said, ascending colon starts from the end point of our cecum, which is 12.6 centimeter on an average. Okay. It ends in the inferior surface of our right lobe of liver. And in the surface it bends and turns to the left side and continues as transverse colon. Okay. Now, this bending point at the inferior surface of liver, we call it right liver flexure. But liver is very common term. It's layman term. We are doctor. We must use medical terms. Okay. So liver is also known as hepatic organ. Okay. So we call it right hepatic flexure. It sounds cool, right? Now, the relationship of our ascending colon. Anteriorly, you will find some coils of intestine, mainly jejunal part. Also, greater omentum. Posteriorly, you will find iliacus muscle. Then few fibers of our transverse abdominis muscle. Then right kidney, iliohypogastric nerve. Then ilioinguinal nerve. Okay, these nerves are coming down. That's all. Now, transverse colon, which is 50 centimeter on an average. Okay, so do not think that our transverse colon starts from here and straightly goes to the left side. No, it starts from our right side, inferior surface of right lobe of liver, which is known as right hepatic flexure. So it starts from our right hepatic flexure and it goes as parabolic nature and goes to the left side and posteriorly and ends in the inferior surface of spleen, and it bends inferiorly, and this bend point we call it left spleen flexure. Now spleen, it's a common term. We should call it splenic. It sounds cool. So it is left splenic flexure. Now the relationship, it comes that anteriorly you will find greater omentum, few muscle fibers, okay, and in posteriorly you will find duodenum, mainly is the second part of duodenum, head of the pancreas, okay, then few coils of intestine, mainly jejunum part, and left part of the kidney. Okay, that's it. Now, I did not tell about one thing, that this large intestine is also known as colon. So you can call this right hepatic flexure as the right colic flexure, and the left splenic flexure as left colic flexure. But you have to say specific, left colic, right colic. No, but it's your wish. And now I'm going to talk about our descending colon. Okay, the descending colon starts from our left splenic flexure, as I talked about already, flexure, and it goes straight down to the left iliac fossa. Okay, so whatever the structure you find in the relationship of the right side, same to same you will find in the left side. Okay, same few fibers of transverse abdominis muscle, then left iliacus muscle, left psoas muscle, then left side of genitofemoral nerve, left side of testicular artery, testicular vein. In female, you will find left side of ovarian artery, ovarian vein. Okay, same iliohypogastric nerve, ilioinguinal nerve. Okay, cutaneous nerve. All the same things in relationship, nothing more. And anteriorly, you will find few coils of intestine, which is ilium part. Okay, jejunum stays above, ilium part stays below. Now, I'm going to talk about our sigmoid colon, which is almost 36 centimeter and starts from our left sided iliac fossa, specifically over the left pelvic brim. Okay, and then it turns to the right side and ends in our sacrum, mainly S3 segment. Okay, third segment or third sacral vertebra. Okay, at this level. Now, it always rests over the bladder in male, female, but in female it also rests over the uterus. Okay, so here is uterus and here is urinary bladder, and over these two organs there is sigmoid colon in female, but we don't have uterus. We men don't have uterus, so it lies over the bladder. Okay, that's it. That's the differential point. Nothing else. Nothing else need to know about sigmoid colon at this level. Okay. Now, this sigmoid colon continues as rectum. At which level? S3, sacral, third position of vertebra. Okay. And this rectum, it's a very short, almost 3 or 4 centimeter, and straight ends into our anal canal. That's it. Finish. Now you need to know something special, which is Tinea coli. Tinea coli, whatever you want to say, you can say, but this is very important. It comes always in exam, asked in viva. Also, examiner asks you to show in practical. Okay. So this Tinea coli is basically a large band of smooth muscle fiber, as you can see in this photo. This smooth muscle fiber is mainly supplied by parasympathetic nervous system. Now, this Tinea coli starts from our tip of the appendix and it continues to the cecum, to the ascending colon, to the transverse colon, to the descending colon, to the sigmoid colon, and ends in the end point of our rectosigmoid junction, which means where the sigmoid colon ends and the rectum starts. At this point, this Tinea coli ends. As I said, these hollow organs, small intestine, esophagus, stomach, these all hollow organs has circular smooth muscle, which helps as peristalsis movement. And these circular muscles contracts muscle like this. But suppose this is a hollow organ like this, like the vertical structure, and this Tinea coli are longitudinal muscle fibers, and this vertical structure contracts like this. Okay, it's not like smooth muscle, it contracts like this way. So this vertical or the vertical muscle fibers, it contracts the entire part of the sigmoid, entire part of the large intestine like this. Okay, vertically or the longitudinally it contracts. It's very difficult to make you understand. You have to imagine. Okay. I'm just trying my level best. Okay. Now this Tinea coli has 3 parts. One is Tinea libera. Tinea libera presents in front of our appendix, in front of cecum, in front of ascending colon, in front of descending colon, in front of sigmoid colon, and also in front of transverse colon. Okay. Now second, Tinea mesocolica. This presents posterior medial surface of our appendix, posterior medial surface of cecum, posterior medial surface of ascending colon, posterior medial surface of descending colon, posterior medial surface of sigmoid colon. Okay. And the third part is Tinea ommentalis. Okay. This presents posterior lateral surface of our appendix, cecum, ascending colon, descending colon, and sigmoid colon. 1 minute. I did not talk about our transverse colon. What happened to transverse colon? Tinea mesocolica and Tinea ommentalis combines and presents posterior part of the transverse colon, because transverse colon has no posterior medial or posterior lateral surface. It's just flat in horizontal manner. Okay. Now, due to this Tinea coli and the inner circular muscles, this intestine forms a bulge formation. Okay, this bulge we call it hostra. Okay, as you also can see in this photo, these bulges are known as hostra, and this hostra and this tinea coli consist of loose fat. Okay, loose fat we call it epiploic appendages. Okay, epiploic appendages. That's it. These things you have to remember, and these things you have to show in your practical exam. Now, the blood supply for colon, large intestine. Okay, so it has basically two parts. One is arterial supply and venous drainage. First, arterial supply. This arterial supply has two parts. First part comes from our superior mesenteric artery. It supplies our appendix, cecum, ascending colon, and few parts of our transverse colon. And the next part comes our inferior mesenteric artery, which supplies our few part of our transverse colon, descending colon, sigmoid colon, and rectum. Okay. Now here is extra knowledge point. You have to know that sometimes it comes in our MCQ based exams. Sometimes examiner asks, which is, as you can see in this photo, that this superior mesenteric artery and inferior mesenteric artery, both arteries are commonly connected with one single bend shape or U-shaped artery. This artery is known as meandric mesenteric artery of Moskowitz. Okay, and this arc formation is known as arc of Riola. And the venous drainage. The venous drainage is done by our superior and inferior mesenteric vein. Superior mesenteric vein goes straight, and the inferior mesenteric connects with our splenic vein. Now these two vein formation our portal venous system. Now as you can see in this photo of our nerve supply of large intestine, it has two components. One is sympathetic, another is parasympathetic. Sympathetic supply is done by our superior and inferior mesenteric ganglions. That's it. And the parasympathetic is done by our pelvic nerves and the vagus nerve. Now the microtomy. In microtomy, you need to know that our entire large intestine is covered by simple columnar cell from inside, associated with goblet cells. Okay. Now this columnar cell consists of crypts, lots and lots of crypts. Okay, for absorption purpose. Now this columnar cell ends in the junction of anal canal and the rectum. Now the last part, function. Function of our large intestine is basically absorption of the last remnant of nutrients which are coming from small intestine, because maximum nutrients are already absorbed by our small intestine. In large intestine mainly it absorbs our water, few carbohydrates, and few parts of our fat. That's it. And very small portion of our protein parts. That's all. This entire large intestine is full of our gut flora. Gut flora means our necessary helping bacteria. Now you will say bacteria is bad. No, not at all. Few bacteria are good, few bacteria are bad. Now I will discuss everything in microbiology chapter, not here. Now why these bacteria presents in our large intestine? Because there are few important vitamins which we cannot synthesize, which we cannot get from outside. So we need these bacteria's help. Mainly our riboflavin, thiamine, vitamin K, and lots of special specific enzymes which we cannot create or cannot synthesize in our body by somehow. We need their help. So if you like this video, you can like and subscribe and share. Anyway, we will meet the next part of our system. Till then, see you. Bye.